Dr. Akash Prabhune is an experienced health researcher with a demonstrated history of working in the research industry and government organizations. Skilled in Microsoft Office, statistical tools, public speaking, monitoring evaluation and learning, healthcare management, and data management. Strong research professional, he has worked with the Indian Council of Medical Research, the state governments of Tamil Nadu and Karnataka. Recently, he has been working closely with the government of Karnataka to provide data analytics support for the management of COVID 19 in the state. He is PhD Fellow for Health Informatics at DIT University and Foundation of Healthcare Technologies Society.
I chose specifically a topic which is very near to consumer health informatics rather than going into core public health epidemiology. And that's why we will talk about the linkages of diseases with disease burden with consumption of demineralized water, and how can AIML applications actually help in with adhering to the principles of consumer health informatics to improve the situation or to prevent a disaster that might strike in the next decade or coming 5 or 7 years. So what I have arranged my discussion today is like we will define the problem, we'll talk about the gaps that are currently existing in literature and also the gaps in current behavior. What is the scope of research? Then how can we develop something called as integrated water quality index? And how can consumer health informatics and data science applications be implemented to scale the water index, which can be taken up? So the importance here is that the scaling should be implemented and it should be taken up for a general use. So that is where we will focus in the later stage of the lecture. So whenever a question arises, like what should be the best quality of water, or what is the ideal drinking water, the reference go back to Rig Veda, where it's clearly mentioned that it should be what they call as Shitam Sushi Shivam Ishtam and Vimala Lagu Shuktam. So it clearly, the importance is that there is a highlight and there is importance on nutritive value and required minerals in water. And the other factors like cold, clean, transparent, and the acid-base balance should be there. These all factors are essential to qualify or to say that the water is best suited for drinking. However, what has happened in post-industrialization era is that with industrialization, urbanizations, the legacy water resources like the open lakes or the community water resources or the river banks have been polluted. There has been misuse of the water, and still that water is still being consumed in one or another way for drinking. And that led to a bigger problem of extremes, which you call it, that there was one population particularly which was exposed to the polluted water. The people who had means to actually take care of that pollution shifted towards what we call as demineralized water, or what has been heavily and exclusively promoted since past 2 decades across is the RO drinking water. And this shift of drinking water, like using purifiers or RO, reverse osmosis, UV ultrafiltration methods to purify water and get the water which has the lowest TDS quality, has been promoted as the best water for drinking, while it's not true. So even if you come to the literature that is available, the WHO report also, which looked at about 80 observational studies, clearly indicated that there is a protective effect if the water has dissolved minerals like calcium carbonate or magnesium or calcium, and that has been shown that it will lead to lesser deaths due to CVDs or due to the cardiovascular diseases. And the studies are not limited only to Western countries like or anything. It has been conducted in India. There have been studies that have been conducted in Asia, where there has been the literature or the evidence clearly states that there should be some quantity, or the what we call as the minimum quantity of minerals, the TDS level that is recommended by the water standards, should be there in water, so that it should be fit for consumption. And there was also data that actually there are studies that were actually done very recently, like a 4 year or 5 year back, like the Gupta and Set et al. Or Ray et al., which looked at the packaged drinking water, which also looked at the RO drinking water, and they clearly indicated that the data indicated that drinking RO water was linked with vitamin B12 deficiency, and more importantly, it also increased the risk of developing cardiovascular diseases. There was also indication about mucous membrane irritation, ulcers, and other diseases which were in long term linked with continuous use of RO water. And there is no any dearth of standards, or there is no any limitations of like saying that there is no standards for water. The Indian water standards 2012 clearly indicate what should be the organoleptic and physical properties of water, saying that the color, odor, pH, taste. Some of them are objective, some of them are very the color and odor are subjective in some ways, but still there is a standards are available, and we can see there is a very broad range in India from 500 total dissolved solids per milligram or milligram per deciliter till 2000 TDS milligram per liter. So that's a broad range of permissible and acceptable. So the desired and permissible is still a broad range. Now, what is even after all these things available, the literature is clearly evidently saying that there should be lesser focus on drinking demineralized water, and the water should be the drinking water should be within limit. Most Indian households today have installed electric water purifiers, which is mostly due to the aggressive campaigns that these companies have. So that these companies have been running on. And one of the paper that I went to, the KC Verma Italy, they have given the name called as water fat, and that's true because even if you look at the picture here, it's from my own water purifier which I use at my home, and you see the TDS levels at 6 ppm, which is as close as distilled water, and that's water that I myself or my family is consuming. I don't know, for past 2 years. But this part is about consumerism, where people have been fallen to the advertisement campaign. So the strategic placement of the marketing companies and marketing ventures, saying that the RO water or the higher the lower the TDS value, the better the water is for your consumption. Again, these two images show that my tap water, which is delivered by the municipality here in Bangalore, has a ppm limit of I think 467, and while my RO purifier goes as low as 6 and something around 30. So when I was working for this lecture also, and I was shocked to see that this is what I am drinking, and then I have to take call, like I have to replace my water purifier or not. But this is story not for my house, but it's across all the houses which are actually low middle income or high income, where we all have it fallen to some or other ways to the marketing fads or water fad, and install such devices in our home, and then unknowingly or inadvertently we are exposed to the risk of drinking demineralized water. Now, there are two parts of this. Like, there are actually a huge proportion of population which has without access to safe drinking water, and 21% of countries' diseases are water related. However, these are directly water related. We are yet to estimate how many diseases are indirectly linked to the consumption of demineralized water in India. Like, there are, because the process and the risk is not clearly evident as with the, say, drinking unpurified water and developing a diarrhea is clearly evident from literature. We can see a clinical cohort of patient drinking water, getting exposed to polluted water, getting a diarrhea, getting treated, getting cured. So that is still, we can document that process. But in this case, specifically when it comes to demineralized water consumption, the risk is accumulated over the years, over 5 years or 10 years. The demineralized water content keeps on increasing the risk of developing what we call as chronic diseases, specifically, not even cardiovascular, or chronic diseases. And on the other hand, the industry, the water purifier industry, has been continuously showing that it has been increasing its revenues, increasing its sales. Though at this point today, like the risk was taken in 2020, the research, the penetration of electric water purifiers is still 8.7% of the total Indian households, and non-electric water purifier is at 3.5%. The growth is still increasing. The industry is increasing at a rate of 5.1%, poised to increase. So over the next years, we might see that this 8.7% will increase somewhere around 15% or 20%. And that again will add to the population which will be exposed to this risk factor of demineralized water consumption. Now, this is where we actually have to bring on a research perspective and how research can actually uh, help us to combat the what we call as the epidemic of RO water purifiers or demineralized water consumption. So the concern today is that most of the urban population is shifting towards the RO use and the demineralized water, and which again increases their exposures to the side effects of drinking demineralized water. And this is not only a phenomenon in urban India, but it's also dripping down to tier 2 and tier 3 villages. And then there is another fact that is the community-based RO water purifiers, which actually uh, have been marketed. The politicians are also behind opening these water ATMs so that they can show that they have done something for the community. But indirectly, they are actually doing disservice to the community. So what is the priority here? The priority first should be that there should be something called as integrated water quality index. The same way what we call as a CIBIL score or the credit score is used by banking sector for disbursement of loans all across all banks follow that score. It's a standardized score used across India at least, and it's the score is taken as a what we call as gold standard while for giving credit to the creditors. And second is once we develop the index, there should be a consumer informatics approach wherein all the stakeholders should be brought on a single line of understanding, saying that the index should be used by them while promoting the water consumption, or while building new houses, or while giving connection to the new residential areas, or even while selling the water purifiers. Now, when we go to the integrated water quality index, a lot of work has been already done, and the latest being the Mukhate et al. They have done a substantial work specifically in India, where they went through various quality indexes that are already been existing. They found that the problem is that these indexes had a subjective weightage assigned to various components of the index like pH or TDS or the minerals like calcium, magnesium, and all those things. And the subjectiveness of the weight actually changed how the index worked. That's why the Mukhate et al. Presented something called as objective approach, where a desired limit, what is already given by the Bureau of Indian Standards, and a maximum permissible limit, a broad range can be considered to assign weightage to these indicators, and thus that can be used for developing the index. However, so when we come to the indexes, I think public affairs centers has been working on various indexes. We have something called as public affairs index, and it's a flagship product of the organization, where we look across various pillars, indicators, and we try to arrive at a composite index ranking states on their governance perspective, that is equity, growth, and sustainability. And for developing the index, we have tried various methods from simple average to PCA or to factor analysis, and we are trying to actually see how the machine can assign weights to these factors. Now, when it comes to water index, it's very clear that there are limited around 5 to 10 indicators that have to be assigned weights, and thus it requires a lot of data coming from various sources that can be run through a machine, wherein factor analysis can be applied to work on the variance between this data, and thus the weightage can be assigned. However, the work should not be in silos, and it requires a multi-sector collaborative effort. There needs to be what we call as a campaign of awareness about the side effects of using demineralized water for drinking, and there should be what we call as a collaborative effort between multiple government, non-government, academia, even manufacturers of the water purifiers, that this water index will actually be helpful for across all the spectrum, and that should be the approach while we develop this index. Now we are shifting from developing index towards application of index. Now, when we come to application, the WHO, the World Health Organization, has given something called as the surveillance loop, which is actually a framework for conducting a surveillance, and we can actually take the framework given by WHO and implement the same framework for developing water quality index. So the framework is very easy. We know the risk factors, diseases, that forms our data. The data will then, once you analyze or you interpret, it transfers to information. The information part should lead to decision making, or what we call as public health action. The decision making or action can be termed as intervention, and when the intervention is applied, it will lead to effect, and then the results would be some change in behavior or change in attitude or change in the practices. So these results should be documented and publicized, because the importance of consumer health information is that it depends upon the consumers. Consumers actually demand high quality services from the public, whether it's healthcare, whether it's water purifiers, whether it's even municipal corporations or private, public, any providers. Consumers always demand high quality services. They should be able to make their choices wisely. Like if the water that's coming to my house is below 500, having a TDS below 500, I should have not been even suggested to use a RO water purifier by the manufacturer, or there should be some way that I would have been made aware that I don't need a RO water purifier, a ultra filtration or a ultraviolet water purifier would be sufficient for to satisfy the water that is coming to my tap, to purify the water that's coming to my bed. But that is where there should be options given to people to make wise decisions, and that is only being possible when there's an active participation from industry, because they are the ones who try to promote the products to the consumers. They are more into their budget spends are towards um, modifying the consumer approaches and then also modifying the consumer decisions. Everyone wants choices. Even the industry wants choices. Even the general population wants choices, and there's also time constraint and busy lifestyle. Like if suppose we develop a water quality index and it's in a paper which is published somewhere 5 years back, even the person like me who is working in research would not find time, or would find it very difficult to go back and look at that index and tell that, okay, this is what water I want. So it should also be very in line with what the consumer is demanding. So these around 5 factors are actually the key basis on how we can implement the water quality index. Now, another factor is that when we develop the index, it has to be there should be a surveillance system which actually keeps link of all the information. And the AI ML part is that the machine keeps on updating its the what we call as the parameters as the time changes or as the geography changes. So there needs to be a crowdsourcing of data, and it should be presented in a very simple and integrated dashboard, which can be seen across mobile phones, which can be seen across, say, laptops, PC machines, or even applications. The In such ways that it can be shown across multiple populations. So if you go in a rural area, SMS can also work there. We don't require to carry a smartphone or something to show the index. And then the factor comes like sorry. So when we are developing a surveillance system, the focus should be that it should be a passive surveillance system, because developing an active surveillance system has a huge cost implications. It requires a dedicated resources which are real-time working to manage the surveillance system. Like FSSI has its own surveillance system for food safety. However, the system is only limited to certain fact and certain food stuff, certain geographies, and specifically certain what we call as the certain seasonalities. However, if we want to develop a what index which is actually available across India, or say for sake of development, for a pilot study, if we want to do this one specific geography, it should be real time, and it should be linked with the data that has been coming from our water purifier, that is coming from our municipal suppliers, or also from the people who the industries which sell bottled water. So, and more importantly, after even developing the crowdsource information or crowdsourcing, there should be a advocacy campaign that the stakeholders should use the voter index as a de facto indicator for making purchasing of new houses or building a residential commercial complex. The same way that the CIBIL score is used across the finance industry to for the credit eligibility. Finally, so there has been a lot of research done. There is no dearth of research indicating clearly that demineralized water consumption is a health issue, and even though it doesn't show its effects acutely, it's a chronic issue. However, over the about second half of past decade, the consumerism and aggressive marketing has made it very what we call difficult to actually choose, make a wise choice out of the available options for drinking water. Thus, there's a what we call as there's a very clear need for developing the index, and that index should be based on surveillance system, and it should be used or implemented in a way that it creates public awareness. It leads to informed decision making across the section of society, not only to a particular population, not only to a particular area, but the work that has been that should be scaled up across the country or across the geographies, and it should become a standardized approach, because at this point we know that there is a fast shift towards the demineralized water. The same thing happened. So it's an impending disaster in a health system that today, if even with 8% population using water purifiers, and with clear evidence, there is not much that has been we're not able to link these adverse events with the uh, not able to link the risk factor with the adverse health event. Say a decade later, it would be a huge burden than like what happened with tobacco industry in 80s, or what even happened uh, about the fast food industry in early 90s, that there was always a indicator that the risk is impending on population, there is direct or indirect linkage, but due to various factors, the risk was not seen, or the risk was like dismissed for that period. And then at a decade later, we were actually what we can see say as we were actually facing the highest burden of NCDs, or we're facing the highest burden of cardiovascular diseases and deaths due to heart attacks. Thank you.